you, Mr. Deputy President. On the 19th of August 2025, the New South Wales Government and the Health Services Union New South Wales branch announced that a final agreement had been reached achieving pay increases for public health officials in New South Wales. This is a historic win for public health workers, having experienced 12 years of wage suppression under the public sector wages cap enforced by the previous Liberal government. As a result of the incredible work and determination of the HSU, as well as the Minns Labor government's decision to scrap the wages cap, 60,000 health workers, including allied health professionals, hospital scientists, cleaners, security officers, and patient transport staff, will see a total increase of 8.5% to their wages over the next 2 years, backdated to July 1, 2025, inclusive of a 0.5% rise in superannuation. This is the best pay rise the HSU New South Wales branch has achieved in over 20 years. The pay deal covers union members working at city hospitals, rural health services, and community health centres. It will see a hospital-assisted salary rise by over $10,000, a ward person salary increase by $10,400, and a security officer salary jump by an additional $10,500 by 2027. Other award reform highlights achieved by the HSU New South Wales branch and the New South Wales Government include a higher duties allowance, meaning workers will be paid after 3 days instead of having to wait 5. Roster change notice increased from 2 weeks to 4 weeks. Rest periods between shift increased from 8 hours to 10 hours, and the modernisation of more than 50 allied health awards within the sector, reflecting current roles and responsibilities. The agreement had over 90% of 10,000 HSU members participating vote in favour, signalling that these reforms were more than necessary. These reforms ensure greater recruitment, retention and morale in the health workforce, and recognise that non-clinical staff are highly essential in delivering quality care. This extraordinary win sets a precedent for how governments and unions can work collaboratively to deliver meaningful and sustained change. These reforms will ensure that our health system is at its best. This win will reduce burnout, improve working conditions, and foster a culture of respect and fairness. It shows the importance of making sure that workers feel valued, heard, and empowered to continue providing the very highest standard of care. I want to commend Gerard Hayes, the New South Wales ACT and Queensland Branch Secretary, and the whole team at the union who have worked tirelessly night and day to ensure these awards provide the protections desperately needed for our public allied health workers. I'd also like to commend the delegates and members who were vital to this achievement, showing that when health workers thrive, our quality of health care is at its very best. Mr. Deputy President, this all comes on top of a 4% pay rise for public sector workers, which happened in the first year of this government. In December 2023, the HSU achieved an average 25% rise for New South Wales paramedics, which will be phased in over 4 years. 100% salary packaging for over 50,000 workers, backdated to July 2024. Previously, these workers had to share the benefits of salary packaging with the Department of Health. And finally, Mr. Deputy President, on top of all that, I just wanted to point out how successful this union has been in New South Wales. From a situation where they were placed in administration, Secretary Gerard Hayes took over in 2012 and has absolutely turned that union around, growing the union massively in membership, over just over a decade and achieving those stellar results which I litigated throughout the speech. It's a credit to unionism, it's a credit to his leadership, and it's a credit to their members and delegates who work so hard to achieve it.
Honourable Scott Barrett.
As we've reached the end of our winter sporting season, I just wanted to take the opportunity to thank and